Aloha, and welcome to another segment of Medicare Answers in Minutes. Today we will be discussing coordination of Medicaid and Medicare. Both those programs work together to bring you a comprehensive list of benefits and services that many people need when they are Medicare age. In Hawaii, Medicaid is called Quest Integration. It's also known as MedQuest, so you might hear it described by those names. To be eligible, you must be a Hawaii resident. You must meet income requirements. Also, program is available for the aged, blind, and disabled. Quest Integration Health Coverage provides many health services, including doctor visits, hospital care, and these services that are provided often will cover whatever Medicare may not cover. So some items Medicare covers, some items Medicaid or Quest Integration covers, and that's why it's important to understand how the programs coordinate. Now, one of the things that's very confusing about how Medicare and Medicaid coordinates is the Medicaid services are delivered through what is called managed care organizations. These programs are offered in Hawaii by 5 different insurance companies: Aloha Care, HMSA, Kaiser Permanente, Ohana Health Plan, and United Healthcare Community Plan. They provide those services along with long-term service and supports. So many times a person may have a Medicare plan from one insurance company and they get a second card. That second card could be one of these managed care organizations programs because you have Medicaid. So when you have Medicaid and Medicare together, you can have Medicare from one insurance company and Medicaid from one of the 5 insurance companies listed. So what is Medicaid again? Again, it's a program that's based on your income. And in Hawaii, you can have 5 different companies that actually provide these plans: Aloha Care, HMSA, Kaiser, Ohana, and United Healthcare Community Plan. But the best way to get your Medicare and Medicaid program is to have both your Medicare and Medicaid from the same insurance company. Now, just a little brief overview of Medicaid. Medicaid was created by the Social Security amendments way back in 1965. It was created as an entitlement program to help states provide medical coverage for low-income families. Each individual state manages their Medicaid services and programs, and eligibility is determined by income, record of employment, how much you earn, and your number of dependents. So Medicaid has been around for quite some time. Now, the Affordable Care Act, which was signed into law in 2020, actually was aimed at expanding Medicaid and increasing health coverage for low-income individuals throughout the country. So it's actually 2010 when some of the programs became even more available to more and more residents. And especially for people, again, who qualify for both Medicare and Medicaid, the expansion really allowed them to have additional benefits at low cost. Now, how does this Medicaid program get funded? Well, before the Affordable Care Act, the federal government shared in the cost with the states. But this might surprise you. The states actually covered not the full 100%. The government paid 57% of the amount of these programs, and the state picked up the rest. But after the 2010 Supreme Court decision, the federal government agreed to cover the total cost of Medicaid expansion for several years. So from 2014 to 2017, the government paid 100% towards the Medicaid expansion costs. That just means the coverage to cover people. And after that, between 2017 and 2020, the government will cover 90% of the cost. That's still way more than the 57% the government used to cover. So it's very important for people to understand how Medicaid works, and especially if you have Medicaid and Medicare together. The main factor in deciding if you're eligible is where your income is in relation to the federal poverty level. Most people don't walk around thinking about, oh, gee, do I meet the federal poverty level? But what it has been set at is $22,000 for a family of 4 and about $27,000 in the state of Hawaii. Our expenses are a little bit more here in the state of Hawaii, so we often have higher thresholds to meet, which is a good thing. And if you're single, I believe it's around 16,000. So Medicaid eligibility does vary by state. So if someone in another state qualifies on a lower income and you go, oh, my income might be too high, it's important to contact your state Medicaid department because you may have higher thresholds to meet because you live in Hawaii or Alaska. Now, how is Medicaid administered? Medicaid is actually administered by the federal government in terms of they set the general guidelines. So the federal government sets general guidelines for the Medicaid program, but it's each state determines the policy, rules, and regulations. So when you're looking to qualify for Medicaid, you will be working with the state that you live in, not the federal government, even though, as we learned in the slide before, the government pays 90% of the cost. Now, what does Medicaid cover? Well, federal law and regulations require the states to provide certain benefits. These benefits are mandatory. They include hospital services, lab, x-ray, skilled nursing, physician, home health care services. This becomes very, very important to someone who has Medicare if they have a low income, because with Medicare, Medicare does not cover 100% of your costs. So when you do qualify for Medicaid as well as Medicare, then you will be able to get assistance paying copays and deductibles that Medicare does not cover. And certainly inpatient hospital can be a pretty big one. So it's good to have that additional coverage. In addition, Medicaid may offer benefits that Medicare doesn't cover, and that will vary by state. So in some states, and Hawaii is one of them, there is dental coverage available. Dental coverage is available if you have both Medicare and Medicaid, and that will be at no cost to you. And then there is chiropractic care in some programs, hearing aid services in some programs, also vision, occupational, and speech therapy. But you have to understand what is available in your state, so you cannot assume that every state will provide all of the services listed. But once again, what Medicaid does is it does cover some benefits that Medicare does not. Medicare savings programs. Many people do not know how to access Medicaid when they have Medicare, but Medicare actually has developed a program that they call Medicare savings programs. They identify how much you will be able to receive from your state by qualifying you as a qualified Medicare beneficiary. That's a person who will receive maybe help with your Part B premium, Part A and Part B deductible, and all of your Medicare copays. So qualified Medicare beneficiary comes with the greatest amount of benefits from the state to go along with your Medicare. SLMB, or Specified Limited Medicare Beneficiary, pays just your Medicare Part B premium. So even if you don't qualify for full Medicaid through your state, you may qualify for help with the Medicare Part B premium. In 2020, the Medicare premium is $144.60. So if you can save that every month for a full year, that's quite a bit of savings, and you can use that money for other things. There are also other types of beneficiaries that come under the program. So every state, again, sets their own rules and policies, so it may be different. Once again, these programs are administered by Medicaid, and they all have asset and income limits. But a beneficiary may have Medicaid and a Medicare savings program as well to reduce their out-of-pocket costs to zero. Now, when you have Medicare and Medicaid together, Medicare has an agreement with other insurance companies that allows Medicare to send the claims directly to the other insurance carrier automatically for processing. This certainly eases the claims process for the beneficiary. So generally, when you work in the state of Hawaii and you have Quest integration, if you qualify for both Medicare and Medicaid, you will complete an enrollment application for a program that will give you one card that can take care of all of those benefits. So when you pick up a plan through one of the managed care organizations, it makes it so much easier for you to get all of what you're entitled to from both Medicare and Medicaid. Now, Medicare has a general rule. The general rule is once you qualify for Medicare, If other conditions are met, Medicare is going to be primary. In other words, Medicare will pay first. The beneficiary must have both A and B before a secondary insurance will pick up any part of the claim. And if the beneficiary does not enroll in Part B of Medicare when first eligible, they may have a late enrollment penalty and they may not be able to qualify for this program that takes care of having your Medicare and your Medicaid cover your claims both directly to lower your out-of-pocket costs. Now, the general rule with Medicaid is Medicaid always pays last. So if there's a possibility that another insurer or payer is available to pick up a claim, Medicaid will not pay for that claim until it is proven otherwise. So a lot of people run into difficulty with that because they are just not aware that Medicaid pays last. So they get a card and it says they have Medicaid, and they just show that card at the doctor, but they're able to see that they have Medicare as well. They will need that Medicare card. So it's so important to understand these basic facts about Medicare and Medicaid, how they work together, because you can actually lose out on very valuable benefits if you're not aware that you may qualify for both. Many of these programs actually require you to fill out an application. It's not automatic. So whether it's Medicare or Medicaid, you have to find out what your state requirements are. Again, just to review the difference between Medicare and Medicaid, Medicare is a program that you pay into when you're in your working years. Money comes out of every paycheck, and that goes towards creating a way for you to get Medicare insurance when you meet eligibility requirements. Those requirements could be due to age or they could be due to a disability. Medicaid is a program that is set by the federal government and funded in part by the federal government, but the state gets to oversee the program. So if you're looking for Medicaid, that will be a state program. So very important to know the difference between Medicare and Medicaid. Very important to know if you qualify that both these programs working together can lower your premiums, lower your deductibles, lower your copays. When you see commercials every year saying that everything is free, everything is zero, generally they're talking about people who have both Medicare and Medicaid. So if you think you want that all zero program, you first need to check with your state to see if you qualify for Medicaid. If you do, you may be able to take advantage of those zero copays for everything or just about. And if not, then you'll understand why with Medicare, you may have some responsibility while you have that program. I want to thank you so much for tuning in today. I have a list of resources for folks. I'm sure that we will make this available to you. So if you do need to reach out to your state of Hawaii Medicaid office or MedQuest office, you'll be able to do so. Aloha.